Spice102.1 FM ਤੇ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਤੁਹਾਡਾ ਸਵਾਗਤ ਹੈ ਦੋਸਤੋ। ਜਿਵੇਂ ਕਿ ਮੈਂ ਪਹਿਲਾਂ ਵੀ ਗੱਲ ਕੀਤੀ ਸੀ ਕਿ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਜਿਹੜੀਆਂ ਇੰਟਰਵਿਊਜ਼ ਹੋਣਗੀਆਂ ਉਹ ਇੰਗਲਿਸ਼ ਵਿੱਚ ਹੋਣਗੀਆਂ। ਮੇਰੇ ਪਹਿਲੇ ਗੈਸਟ ਡੈਨੀਅਲ ਸਮਿਥ ਹੋਰਾਂ ਨੇ ਇਸ ਇਸ਼ੂ ਦੇ ਉੱਪਰ ਆਪਣੇ ਵਿਊਜ਼ ਰੱਖੇ ਤੇ ਹੁਣ ਮੇਰੇ ਜਿਹੜੇ ਪ੍ਰੋਗਰਾਮ ਨੂੰ ਮੈਂ ਹੁਣ ਅੱਗੇ ਤੋਰਦੀ ਹਾਂ। Stephen Duckett, former CEO of Alberta Health Services, defined special treatment in his explosive Toronto speech as go-to guys acting for Health Region CEO to get special treatment for prominent people. Duckett was so very much convinced with this happening that he developed an AHS policy condemning requests to provide preferential care for prominent people. According to him, the policy was provided to Alberta Health Services Board at the meeting in May 2009. Its mere existence shows that Duckett and the board precluded a problem and were determined to stop it from spreading through the new provincial super board. In November, H1N1 flu vaccinations for Calgary Flame players, officials and families was the example of one arrangement by AHS at a time when thousands were waiting in line. This was not a wise move at that time. Anyway, the official responsible was promptly fired, but also proved dramatically that queue jumping existed. VIP treatments were at place. Dr. Parks and Dr. Sherman are describing this thing. And now, Alberta NDP leader Brian Mason's shout for call in the cops is, I think, that latest healthcare crisis as high as it will go. But do we need witnesses with these facts? So today we have NDP leader Brian Mason now on Hard Talk. Leader, welcome in Hard Talk.
Thank you very much. Good to be here.
Leader, no doubt this practice is ethnically wrong, but you called for RCMP. What is your point of view? Is it legally wrong too?
It's wrong for elected officials or senior officials within the health department to use their power, their extra authority to violate the law. Now, the federal legislation is called the Canada Health Act, and it says that you have to provide health care on a uniform basis, which means you need to provide it on a basis of people who need the service the most get the treatment first. And it means that you can't have people breaking the rules or setting a new order that people are seeing because they have political power. And the Criminal Code of Canada says that any elected official or other official who uses their authority or their position in order to obtain special treatment for themselves or the family or the friends is guilty of a criminal offense. So that's why we've asked for the police to look into this.
And now Health Minister Honorable Jean Zwideski was unable to join today, but he said today in his statement that leaked papers are no proof of any queue jumping. What about if RCMP will just say, howdy Brian, but there's nothing to investigate? Then what will you do?
Well, I mean, if they refuse to investigate it or decline to investigate it, there's nothing I can do. All I can do is bring it to their attention and ask them to look into it. My understanding is that they have said that they're treating the complaint seriously. And they'll be talking to Mr. Duckett, and they'll be talking to me. So I'm still waiting for them to give me a call. But we've established a tip line that we've asked people to call if they have any issues that they want to bring to our attention. They can do so anonymously, and the number for that is 780-644-8670, and if people call that number and give us information, if we think that it's of any use to the RCMP, we'll of course let them know. But we're not saying that if anybody got they may have got treated ahead of someone else, that doesn't mean that they're guilty of an offense. But if a politician, if an MLA use their power to get special treatment for themselves or their family or their friends, then that politician may be guilty of an offense, and that's what we're asking the police to investigate.
Now, another view of this allegation, I asked the same question in the same way from Daniel Smith too, that if preferential services were given to prominent people, then why Ralph Klein had to wait for approximately 2 years for his dementia?
Who had to wait for 2 years?
Ralph Klein?
Oh, well, Ralph, I don't know the story about that, but I do know that. For example, I have someone in my constituency who had their surgery for lung cancer canceled twice, and after a 5-month delay, the cancer had spread. Now, I don't know that they were delayed because somebody bumped ahead of them. That's not something we'd ever know. But it does tell me that this is a very important issue, and that people who have serious medical needs where time is very important are not necessarily getting the surgery or the treatment that they need in time to save their lives. And so that makes this a very important issue. My view is that you should be seen you should be seen by a doctor or have your surgery based on how great your medical need is, and not by how important you are in the society. And I think most people agree with me on that.
Agreed. Fair enough. Yes, you're right. And now, compared to other provinces, Alberta spends more per head, uses more health services, and those services cost more. But why it doesn't provide quicker access or, I should say, better outcomes to Albertans? What do you think?
Well, this is a really important question that I think a lot of us are starting to ask. Why, when we spend so much money on health care, are we getting such poor results? And I think that it's because of the ongoing political interference of the Conservatives in our healthcare system. We've seen that they have, intimidated doctors. When doctors speak out, sometimes they're accused of having a mental health problems. We've seen examples of that in the last year. So if the healthcare professionals don't feel that they can speak up about how to improve the system because they'll be punished, then we don't get the solutions that we need to improve our system. And I think that it all comes down to the long history of political interference in the health system by the progressive Conservative government.
And also today, this afternoon, $12 billion budget is released for better health services. What do you think? This will be another spending practice, or province will really get the benefit out of it?
Well, I don't know what the result is going to be. I do know that what they've managed to do is to avoid scrutiny by the legislature of a huge percentage of the provincial budget. I think it's close to 40% of the provincial budget is not debated in the legislature by the elected representatives, both on the government side and the opposition side. So by creating this super board, by creating Alberta Health Services and putting a board of directors in charge, it means that the legislature does not have a chance to examine the budget and debate it. And so we have no guarantee that this money is well spent, and the public has no say in the health budget of the province because the Conservative government have put a board of unelected businessmen in charge.
Thank you, Brian. Thanks for your time. Talk to you soon.
Thank you very much. Nice to talk to you.